Surprisingly, the WHO's threshold and the threshold that is there in Delhi is enormously different. Okay, it's never late to stop smoking. So non-smoking lung cancer is on a rise also.
Gen Zs and youngsters must take a note. E-cigarettes are no better than
we are
tobacco
probably a
cigarettes. How pollution is adding to the menace. Welcome to our podcast, Problem Kya Hai? And the problem has to be with our lungs because Delhi, Bihar, and other cities are struggling to catch a breath. It's because of this toxic air crisis, we are joined by a leading oncologist, Dr. Deepak Koppaka, who's going to talk about lung cancer and how pollution is also playing a major role in it. So let's find out. Thank you, Doctor, for joining us.
Hi, Shubha.
So it's Lung Cancer Awareness Month.
Yeah.
And we would want to know the basics. What is lung cancer?
So let me begin with what cancer in general is. So cancer is the abnormal proliferation of cells within the body. There's usually a regulation that is designed by the body to prevent cells to have this unregulated growth to happen. So what happens in cancer is there is loss of this regulation. Cells fail to die, they just divide and then they grow and then they start to spread to other organs. So this is how cancer evolves within a body. Lung cancer, here cancer starts from the lung cells and then they divide, grow and then they start spreading to other organs. So this is what lung cancer is.
Okay. So doctor, tell us how pollution is adding to the menace.
So pollution is a problem that is actually been there for a while, but now we are seeing it actually cross the threshold and it's evident. The WHO way back a decade back itself said that pollution is a major health concern. Not only cancer, pollution would affect your heart, would affect your brain. There are more number of stroke cases in more polluted places. There are more number of cardiac cases in places where there is more pollution. And eventually air pollution, this air would go into the lung and there is increased lung cancer risk. So WHO said, okay, now you have to, on a health perspective, you will have to quantify it. So they came up with a metric called PM 2.5, which means particulate matter less than 2.5 micrometers in size. And based on this value, they designed and they've actually put some thresholds beyond which there is a risk of diseases that would affect the population.
Exactly.
Surprisingly, the WHO's threshold and the threshold that is there in Delhi is enormous differences there in that perspective.
Yeah.
So the PM 2.5 threshold that the WHO laid down was 5 micron per cubic meter.
Okay.
So that is the PM 2.5 cutoff. Apparently Delhi a week back, probably a couple of days back, had the PM 2.5 daily average more than 150 micron per cubic meter. That is way too high. And the annual average per se in Delhi is 100 micron per cubic meter. That's the average over the year. And the WHO average over the year is 5 micron per cubic meter. Like it's 20 times higher. So this would not only increase the risk of lung cancer, but this would also increase the incidence of diseases like heart diseases, stroke and many other diseases. Overall, lung cancer, when you come down to lung cancer, a 10 micron per cubic meter increase in PM 2.5 increases the lung cancer risk by 6 to 8%. Now imagine this is like 20-fold increase in the PM 2.5 levels in Delhi. So that is a huge concern. You're breathing air probably which is equivalent to breathing a cigarette. So it's scary that way. The government has to recognize this problem. Not only about lung cancer, people on a larger scale are going to have their life expectancy cut down by a significant number of years, not only because of cancer, but also because of stroke, cardiac diseases, respiratory illnesses. So I think it's a huge health concern and we need to act.
Definitely.
Yeah.
I mean, the figures that you've just mentioned are very scary.
Yeah, it's 20-fold high numbers. So I think it's scary. Yeah.
Doctor, if we compare how common is lung cancer in India versus globally?
So India is a very large population per se. In India, lung cancer accounts to, in men, it is the second leading cause of cancer and it is the leading cause of cancer-related deaths in men. And in women, it's around the 5th common cancer in women. But we see a a significant number of lung cancer patients in India, and it probably is the second largest contributor for lung cancers on the global scale.
Oh.
It's because of the sheer population volume that we have, but on the numbers in India where it stands second in men and fifth in women. On a global scale, annually we see around somewhere around 30 lakh new cases, 25 to 30 lakh new cases. In India, we see around 3 lakh new cases of lung cancer. So it contributes to almost 1/10 of the global burden that way. Yeah.
So, what could the possible reason be if we talk about that?
So let us simplify. Lung cancer, the first thing when somebody says lung cancer, we attribute it to smoking. And truth be told, even today, smoking is the major contributor for lung cancer. 2/3 of lung cancers, nearly 63% of lung cancers globally and also from India are because of tobacco and tobacco related products. So that's the fact, and I think that is a preventable cause of lung cancer globally and also in India. So we predominantly have to focus again on these areas also. Now that being said, there is also a stigma that lung cancer patients usually carry. If somebody says they are having lung cancer, we attribute it to smoking. But that's not the case. 1/3 of lung cancers are nowhere close to smoking. It's seen in a significant proportion of patients who are not smokers. If you just pull up all the non-smoking lung cancers, they probably are around the 6th most common cause of cancer globally. So non-smoking lung cancer is on a rise also. One predominant contributor for that is air pollution. Like we discussed, air pollution is a significant factor that is predisposing individuals to develop this non-smoking lung cancer. So that's again something that I would like to tell the audience here is, lung cancer is not always related to smoking, though smoking is a major contributor for lung cancer. There is a significant population that is also suffering from non-smoking related lung cancer.
Exactly.
And we should stop stigmatizing lung cancer that way.
So smokers should definitely stop smoking
during
the pollution.
Definitely.
Like especially
probably if you're having one pack with the kind of pollution that is there in these areas, probably it would actually probably have a additive and also probably a significantly higher risk of them developing lung cancer because of the pollution also.
We're going to play a game and you're going to tell if it's a myth or a fact and why.
Yeah, sure.
Okay. The first on the list is it's too late if you have smoked for years.
Okay, it's never late to stop smoking. I'll put it this way. If a person who's diagnosed with lung cancer continues to smoke, and a person who's diagnosed with lung cancer, it stops the moment they come to know that they have lung cancer, and that's predominantly because of smoking. A patient who stopped smoking would fare much, much better. Their tolerance to treatment would be much, much better. Their responses to treatment would be much better. And the longevity would be significantly higher. Okay? When I say significantly higher, it probably would add on in terms of probably a year or two if they stop smoking compared to the population that would continue to smoke. It is a huge blow the moment they are told about their disease, and probably that is an opportunity for them to make that decision and stop smoking, and they would have a significantly emotional factor in their decision making that would help them to stick with the decision to stop smoking. So I think you're diagnosed with lung cancer, it's unfortunate, but you can now make that change in your daily activities, in your habits, which would probably help you recover faster and help you tolerate the treatment better.
Okay, so that was a myth.
Definitely a myth. Stopping smoking the moment you're diagnosed with lung cancer, you would notice changes right away. You would notice your circulation getting better, your BP falling, your respiratory rate getting better. Probably 10 years into it, your recurrence risk would almost come down by 50%. If you're operated, you're free from cancer, the chance of a second lung cancer happening in your body is down by nearly 50%. So it's always better to stop.
Exactly. So smoking marijuana does not cause lung cancer.
Smoking marijuana does not cause lung cancer. It's a difficult question. We don't know exactly if marijuana increases the risk of lung cancer, but often people who smoke marijuana would have a stick of cigarette along with it. Probably that's how it usually happens in people who come back and tell us, they were addicted to marijuana and they continue to smoke. They continue to smoke the regular cigarettes. So having both smoking marijuana, smoking cigarettes would definitely increase the risk of cancer. There's no doubt about it. People smoking marijuana, we really don't know. It's too early on studying that on epidemiological front. But if you're smoking only marijuana, we don't have an answer. But if you're smoking marijuana and you're smoking cigarette, the risk would significantly increase.
Yeah. Exactly. So are e-cigarettes better than tobacco cigarettes?
Again, e-cigarettes have just come into the market, and we probably probably 2 or 3 years back, if somebody would ask me smoking a regular stick of cigarette would be better or e-cigarette would be better, I would say stop both, and I would stick with the same decision even today. There is new data coming up saying that e-cigarettes also contribute in the development of lung cancer, and this data is premature. Probably a century back, when people said that smoking causes lung cancer, they were looked down and they were always said that probably there's no enough data. With e-cigarettes, probably we are there, but with time, e-cigarettes would again prove to be a significant contributor in developing lung cancer. And again, like with marijuana, people who smoke e-cigarettes would once in a while have cigarettes.
Exactly.
And again, having them both would increase the risk of lung cancer significantly. So e-cigarettes are not safe.
That so Gen Zs and youngsters must take a note.
Yeah.
That e-cigarettes are no better than
yeah, we are probably a century behind when cigarettes came into the market, and there was this scientists saying that cigarettes cause lung cancer. Nobody really paid any heed to their advice, but it was too late. We see that brunt probably 4 or 5 decades later. Exactly. Similarly with e-cigarettes, we might be seeing the brunt a little late, but it's advisable to stay away from e-cigarettes too.
E-cigarettes as well. Are light cigarettes, the SLites one, are they safer than the regular ones?
They're the worst. Trust me, light cigarettes or cigarettes with menthol, cigarettes with filters, these actually would psychologically remove that fear of cigarettes causing cancer. You tend to smoke more of these cigarettes. Just as an example, the easiest way out, okay, your cigarette smoke can be filtered by having the filter at the end of it, the sponge that is there. Unfortunately, what happens is once you have that filter, you tend to take deeper breaths, and then your smoke that was initially concentrating in the central part of the lung now would be going deep into the lung, and those areas have mechanisms that cannot clear out these carcinogens as effectively as the central part, and then there is a higher risk of developing cancers, and there is a new type of cancer that is increasing in incidence in India called adenocarcinomas, and they develop in the periphery of the lung, and they are also now predominantly the causative factor is smoke, is the cigarette smoke. So that is the point that I'm trying to make, that these cigarettes are dangerous because you would be breathing deeper, and to get a higher kick you tend to have more cigarettes. The number of cigarettes would go up significantly. And menthol cigarettes or the light cigarettes, again the nicotine kick that they get, the addictive component would not be enough in this. You tend to take more cigarettes, and that would significantly increase the risk of cancer. So they are the worst. They are the worst. Yeah.
So that was a myth.
Yeah.
So, doctor, do nutritional supplements do not have risk of developing lung cancer?
Nutritional supplements, there is new data coming up on every front saying that nutritional supplements are really not helping the general population. Let it be the cardiac nutrition supplements or the stroke nutrition supplements, similarly cancer supplements. They're really not reducing the risk of cancer. This predominantly was 40 or 50 years back saying that lack of multivitamins is the reason that people get sick, cancer, cardiac issues and whatnot. But today's date actually over-supplementing or not taking the right supplements significantly increases the risk of cancer also. For example, lung cancer, there was data saying that, studies happening in the West where they try to supplement these patients with antioxidants, beta carotenes, and they really found a surprising data that they were introduced into the diet to see that the risk of cancer comes down in the general public. On the contrary, more number of lung cancers were seen in the general public that took these supplements. So beta carotene actually increases the risk of lung cancer. Some antioxidants increase the risk of lung cancer. Why does this happen? We really have no answer currently with us, but these supplements generally we advise the general public to avoid these supplements. Having a balanced and a healthy diet actually is helpful. Supplements it's better not to take supplements unless your doctor prescribes them. Okay, we have a lot of people coming from the US getting the multivitamins and the supplements, and then they, as a token of gift, they give it to their loved near ones. But it's not advisable unless your doctor prescribes it.
You've got antioxidants from natural food, natural fruits.
Yeah.
So why not take that and
Exactly.
avoid the chemically made ones?
Chemically made ones, and we really don't know how safe they are. You know, these
Exactly.
are the new fad
Credibility
that's taking
lacks.
taking up the public with, but it's really not proven that it is safe. So the public should avoid having the supplements unless your doctor advises them.
True. Talcum powder can cause lung cancer.
Talcum powder does not cause lung cancer. Let me be straight on that front.
That's a myth.
That's a myth. Talcum powder, we know the Johnson & Johnson story. At one point of time, talcum powder had some ingredients that increases the risk of other cancers, like the uterine cancer in women and a few set of cancers, but that element is now completely removed from the product making itself. So per se, talcum powder does not increase the risk of cancer. Yeah.
If you have got lung cancer, there's a higher chance of you succumbing to the illness.
This probably was true 2 decades back. It's nowhere near truth today's date. Just to put it into perspective, imagine there's a patient who is diagnosed with lung cancer and unfortunately they got diagnosed in stage 4. Now that's the worst that can happen. And unfortunately, the fact is most often across the globe, patients are diagnosed in stage 4. The frequency of patients getting diagnosed in stage 4 is as high as 50 to 70%. So nearly 2/3 of the patients are diagnosed in advanced stage. And I can just tell you that there is one pill on which the patient, if the patient is on that one pill, the patient would live on therapy for more than 5 or 6 years. We don't really know how long it would work. Now, this pill is called lorlatinib. We had the data presented 6 months back in an American conference. And patients with stage 4 lung cancer, when they just put on this one pill, more than 60% of the patients are doing well, not progressing on therapy for more than 5+ years. So imagine stage 4 lung cancer patients doing that well just by taking one pill. So it's not that patients with lung cancer, even in stage 4, would really succumb to the illness. We have new treatments. We are understanding the disease in a much better way. We are targeting the disease specifically. And by introducing the right treatment, patients are doing extremely well. There are patients who are on targeted therapy, the first generation targeted therapy, once the drug was launched, and continue to be on this therapy, and they've reached 14 or 15 year mark. I've recently come to know there was a patient who was started on a certain kind of therapy, and he's the longest survivor on that particular therapy, and he's currently reached his 12-year mark. Just one pill, once in the morning and once in the evening. He's taking that tablet and is doing absolutely well for the last 12 years. So we definitely have to break this myth. Being diagnosed with lung cancer is not a death sentence anymore. We have treatments. Probably there'll come a time where lung cancer would be a disease similar to hypertension and diabetes. Diabetes at one point of time was a death sentence.
Yeah, but it's manageable now.
It's now manageable, and out of every 5 patients, 3 or 4 diabetic patients have been on the medication for more than 2 or 3 decades. Lung cancer would definitely come there. Probably we are in the right track, in the right path to really make these patients live that long. So it's not a death sentence. Go meet your oncologist, and if you're on the right treatment, you will do really well.
Yes, exactly. Doctor, is there a possibility of detecting lung cancer in patients even before the symptoms show up?
Yeah, even before the symptoms showing up, it's really difficult. So this happened during COVID, where patients were screened for the lung involvement, and then we identified a few lung cancers way too early in their journey. But lung cancers being diagnosed without symptoms is a rarity. It probably would happen if you're getting a chest x-ray on your regular health screens, or you're getting chest x-ray for some other symptom, and then incidentally your doctor notices this lung lesion. There is a screening method that we've come up with recently. Over the last 3-4 years, we are using it in a few patients, but that's limited to patients who are at higher risk of lung cancer. This population is the population who've been smoking for a very long time. When I say long time, it's like 20 pack years. You've been smoking 1 pack of cigarette every day for the last 20 years, or you're taking 2 packs of cigarettes for the last 10 years. That would amount to 20 pack years. So patients the general public who's into this category, who are 50 years and above, would fall into the high risk group, and then doing a low dose CT scans on an annual basis would help us identify lung cancer in early stages. So this would help us identify lung cancer, and it would decrease the risk of lung cancer-related deaths by almost 20%. That's huge in lung cancer. But that would, at least the Western data predominantly suggests that this would benefit the smokers or at high risk. Now we have data coming up from the east of the globe, coming from China, Taiwan, and these countries where the inherent population is at higher risk of developing lung cancers. In this, patients who fall into the families which have had lung cancer, patients who smoke are at higher risk. Even in the population who has familial lung cancer, there is data coming up that this low-dose CT scan can help pick lung cancers in an early stage. It is still in a preliminary stage. I wouldn't advise everybody who's worried about developing lung cancer to go get this low-dose CT scan, because it has this inherent amount of radiation associated with it that might increase the risk of other cancers that the body can actually develop because of radiation. So it is not there yet in prime time, but those who smoke, who've been intense smokers, and if you're more than 50 years of age, please go meet your doctor. If he's a pulmonologist or an oncologist, he would advise on where a low-dose CT scan is being done. Go get an annual low-dose CT scan to identify these cancers in an early stage. And this again would give us an opportunity to help educate the public whenever they come for these low-dose CT scans on smoking cessation. What are the methods on trying to help them quit smoking? And then on an annual basis, we can again reiterate, try to see where they are in this journey and what were the reasons that they came back to smoking, and help them overcome that. So probably, yeah, this is an opportunity both to detect cancer early and also try help them quit smoking.
So doctor, what are the symptoms one should look out for if they have lung cancer? When should they go to a doctor?
Yeah, so any cough that's persistent beyond 2 or 3 weeks, you need to visit a pulmonologist. Okay, regular viral fevers and the cough that happens after this usually subsides probably 2 or 3 weeks into the illness. But with lung cancer or any serious illness that's with concerning in terms of the lung health, like tuberculosis or COPD, these most often have cough that persists beyond 2 or 3 weeks. So if you have cough beyond 2 or 3 weeks, it's always advisable to go meet your pulmonologist. They would evaluate and then they would identify what is the cause. Along with this, cough with expectoration and the sputum having blood in it is alarming. So here, if this symptom is there, you have to meet your pulmonologist right away. Whatever is the illness, just go meet your pulmonologist right away. And patients along with this having breathlessness that's persistent beyond a month with cough. Other symptoms like recent loss of weight, feeling weak, and having jaundice, body pains along with these symptoms like cough and breathlessness, you would mandate an immediate appointment with a doctor, and you should definitely go meet your pulmonologist in this situation.
Final words from you, doctor. What would you advise people to keep their lungs healthy? How they can, especially Delhiites, how can they keep their lungs healthy?
So the first and the foremost thing, there are policy decisions that the government needs to take and really bring down the make sure that the air quality of that place is much better. I mean, significantly it should be better than what it is today. Secondly, if you are into smoking, do take help and quit smoking. It's not easy. You will get back, you will come back to smoking. It's a journey. It would never happen with the first attempt, but trust the process. It's definitely, if you're in the right way, you would definitely quit smoking, and that's something that would reverse the chance of your lungs getting worsen with time. You would probably get your healthy lungs back probably within 5 or 10 years. But do stop smoking. That is the most important message. With that alone, you would decrease the risk of lung cancer by 60%. So straight away, you've got the risk of lung cancer down by 60%. So quit smoking. And try to avoid secondhand smoke. If there's somebody smoking in your house, encourage them to quit smoking and at least stay away from that vicinity. You already have a lot of pollution in the air that is increasing your risk of lung cancer. At least stay away from secondhand smoke exposure. Yeah. Okay. So these are my 2 cents on reducing the risk of lung cancer.
Okay. Thank you so much, doctor, for joining us. We spoke on this really important issue, especially what we are going through during these times. Smoking is on high rise and pollution is also, at an alarming level. So thank you so much for guiding us.
Nice
thank you from our viewers for your words. Thank you.
Thank you.